Welcome to our channel. Today, we're diving into a topic that's close to my heart: patient safety. As a doctor, I've dedicated my life to helping people heal, and that starts with ensuring they're safe within the walls of a hospital. We'll be focusing on 10 essential patient safety practices that every hospital in Nepal should follow. These practices are rooted in the latest medical research and are designed to prevent errors, reduce infections, and ultimately, save lives. This isn't just about checklists and protocols, though. It's about fostering a culture of safety where every healthcare worker, from doctors and nurses to support staff, feels empowered to prioritize patient well-being above all else. Let's get started. It might seem simple, but hand hygiene is truly the first line of defense against infection. Imagine a hospital as a bustling city with people and equipment constantly moving. Now think about how easily germs can spread from person to person, or even from a surface to a patient. That's why it's crucial that every healthcare worker, from doctors and nurses to technicians and cleaning staff, follows strict hand washing protocols. This means washing hands thoroughly with soap and water, or using alcohol-based hand sanitizers at key moments. Before and after patient contact, before procedures, after touching surroundings. It's a simple act that can have a profound impact on patient safety. Building on the foundation of hand hygiene, we need to talk about infection control as a whole. Hospitals, while places of healing, can also be environments where infections can spread if we aren't vigilant. That's why hospitals in Nepal should have clear, comprehensive guidelines for infection control. This includes everything from proper hand hygiene to the safe handling and disposal of medical waste, isolation procedures for infectious patients, and the use of personal protective equipment like gloves and masks. It's about creating a system where everyone is working together to minimize the risk of infection. The world of medicine is constantly evolving, with new research, technologies, and best practices emerging all the time. That's why it's crucial that hospital staff in Nepal receive regular training on the latest patient safety guidelines. Think of it like this: we wouldn't want our doctors using outdated medical textbooks, would we? The same principle applies to patient safety. Regular training ensures that everyone is equipped with the most up-to-date knowledge and skills to provide the safest possible care. In the fast-paced environment of a hospital, it's easy to see how mistakes can happen. But when it comes to patient identification, there's absolutely no room for error. Even a simple mix-up can have serious consequences. That's why hospitals should have robust systems in place to ensure accurate patient identification at every step of the way. This includes using at least 2 patient identifiers, such as name and date of birth, before administering medications, drawing blood, or performing any procedure. It's about taking that extra moment to double-check and confirm, because a patient's safety is always worth it. Think about a surgical team in the operating room. Everyone has a specific role, but they need to work together seamlessly to ensure the best outcome for the patient. The same principle applies to patient safety throughout the entire hospital. Clear, effective communication between doctors, nurses, pharmacists, technicians, and all members of the healthcare team is absolutely vital. This means having open lines of communication, using standardized communication tools, and fostering a culture where everyone feels comfortable speaking up if they see a potential safety concern. We live in a digital age, and healthcare is no exception. Hospitals in Nepal can leverage technology to enhance patient safety in numerous ways. Electronic health records, for example, can help to streamline communication, reduce errors, and provide a comprehensive view of a patient's medical history. But it's not just about having the technology, it's about using it effectively and securely. Hospitals need to have robust cybersecurity measures in place to protect patient data and ensure privacy. Just like any well-maintained machine, hospitals need regular checkups to ensure everything is running smoothly. That's where safety audits and risk assessments come in. These audits aren't about placing blame, but rather about identifying potential hazards, areas for improvement, and opportunities to strengthen safety protocols. They provide valuable insights that can help hospitals to proactively address risks before they turn into incidents. Imagine a hospital where every staff member, regardless of their role, feels empowered to speak up if they see something that could potentially harm a patient. That's the power of a strong safety culture. It's about creating an environment where staff feel safe to report errors, near misses, or safety concerns without fear of retribution. This open communication is essential for identifying and addressing potential risks before they escalate. Medications are powerful tools that can heal and alleviate suffering, but they also have the potential to cause harm if not managed carefully. That's why proper medication management is paramount. This includes everything from ensuring accurate prescribing and dispensing to safe administration and monitoring for side effects. It's about having multiple layers of checks and balances in place to prevent errors. Patients are at the heart of everything we do in healthcare. And while healthcare workers play a critical role in ensuring safety, patients themselves can also be active participants in their own care. This means educating patients about their medications, potential side effects, and what to expect during their hospital stay. It also means encouraging them to ask questions, speak up if they have concerns, and be proactive about their own well-being. Thank you for watching. Remember, patient safety is everyone's responsibility. It's about creating a culture of vigilance, where we're constantly striving to do better and be better for our patients. Let's work together to make hospitals in Nepal safer for everyone. This means supporting hospitals that are prioritizing safety, advocating for better resources and training, and empowering ourselves as patients to be active participants in our own care. Don't forget to like, share, and subscribe for more informative videos.